Welcome to the mini-series, The Biology of Meaning, Video 20. In the healthcare field, there is a form of violence that is rarely discussed. It is not always visible. It is not always intentional. But it can have profound consequences for people's lives. We are talking about superficial diagnoses and institutional, structural, and systemic violence within healthcare systems. A superficial diagnosis occurs when a person is quickly labeled without a deep understanding of their history, context, and human experience. These diagnoses can be hasty, reductionist, or based solely on protocols, or even on prejudice. When this happens, the person risks being defined by a label, a negative quality, or a behavior considered contrary to the interests of the hegemonic medical model, instead of attempting to understand the person as a complex human being with the right to question, verify, affirm, or reject. But the problem doesn't end there. There are different levels of violence within healthcare institutions. Institutional violence occurs when the rules, practices, or decisions within an institution end up harming the people it should be protecting. For example, systematic neglect, dehumanization of the patient, and denial of the patient's voice or experience. Structural violence is deeper. It relates to how social and healthcare systems are organized. It manifests when structures produce inequality in access to health, care, or respect for human dignity. Systemic violence appears when these practices are constantly repeated and become part of the institutional culture. Then the problem ceases to be an individual error, it becomes a systemic pattern. From Carl Jung's depth psychology, we could say that institutions also possess collective shadows, aspects of reality that are preferred to be ignored. The philosopher Ken Wilber explains that every human phenomenon occurs on several levels: the individual, relationships, culture, and social systems. If we want to transform medicine, it's not enough to change individuals. We must also examine the structures and institutional culture. The biology of meaning and the Faro integral method invite us to look at the field of health with greater awareness, because when the system loses sensitivity to human experience, something dangerous emerges: silence and pretense. Listening is pretended, care is pretended, understanding is pretended, but the person is still not truly heard. This problem doesn't only affect patients. There is also violence among colleagues within the healthcare system, an issue that is trivialized and left unaddressed. There is destructive competition, professional jealousy, beliefs of superiority, or merit without effort or merit, rigid hierarchies, enforced silences, a lack of self-awareness and humanistic training, racial discrimination, and work cultures that wear down those who care for others. That's why change cannot come solely from the top down. It also needs to originate from within the care professions themselves. Here, Ken Wilber offers his analysis of levels of consciousness, pinpointing the level of psychological, ethical, and conscience-based development from which these behaviors typically operate. When unsympathetic, insensitive, or unjust behaviors appear persistently, they are usually related to developmental levels where empathy and the perspective of others are still limited. Egocentric level. In many developmental models, psychological and ethical, this level is characterized by the absolute priority of self-interest, low empathy, difficulty recognizing the impact of harm on others, and a tendency to justify one's own actions. In institutional contexts, it can manifest as indifference to the suffering of patients or colleagues, depersonalized and indifferent treatment, and abuse of power or hierarchy. Ethnocentric or corporate level. Here, the person already identifies with a group, but empathy is limited to that group. Frequent characteristics include defending the system or the profession rather than the individual, silence in the face of errors or injustices, and a culture of protecting our own, even when inhumane acts are committed. This explains many instances of institutional silence or dissimulation in organizations. Lack of development toward world-centered levels. The highest levels described by Ken Wilber involve universal ethics, expanded compassion, and responsibility toward all human beings. When an institution or individual has not developed these levels, professional practice can become technical without humanity, normative without ethics, and efficient but impersonal. In simple terms, when consciousness remains at egocentric or corporate levels, the other person ceases to be a person and becomes a case, a number, a file, someone to be replaced, a thing, an object. And that's where the risk of dehumanization and injustice arises, and that is institutional violence. In the Pharaoh approach, the goal is not to condemn people, but to raise awareness within the healthcare system, because it is clear that more empathy, more ethics, more human responsibility, and self-awareness of the shadows we carry within us and project onto others, causing harm, are needed. Because true professional maturity is not just effective technique, it is also empathetic awareness. In these troubled scenarios, the role of healthcare advocacy emerges, especially in professions like nursing and social work. Nursing has a historical tradition of patient advocacy, inspired by the work of Florence Nightingale. Social work provides an essential perspective on the social contexts that influence health. Both professions can act as bridges between the system and the individual. When ethics becomes central to care, medicine recovers its original purpose. Health is not just a biological issue. It is also a matter of human rights, dignity, and social justice. That is why we need more than technical knowledge. We need critical thinking, ethical awareness, and humanity in the healthcare field. Because true medicine does not only treat diseases, it also protects the dignity of human life, of the patient, and of the caregiver. Pharaoh learning. A truly humane healthcare system is not measured solely by its technology and techniques. It is measured by how it treats people, both as patients and as professionals. Pharaoh quote, "Medicine without ethics can cure organs but forget people. Technical competence without conscience can produce efficient professionals, but not necessarily humane ones." Subscribe to the channel. Like this video. Comment if you wish. Share this video to raise collective awareness. Study with ESSI El Pharaoh. Learn science with conscience, because in healthcare, knowledge is not neutral, it is vital.